This is Professor of Medicine Desiree Dubonnet, the man who left America to find freedom, who's no longer a man. And we talked about nutritional deficiencies and how they can affect the quality of life. And today we're going to be talking about vitamin B deficiency. We're going to be learning about B vitamins and what we need to know about vitamin B deficiency. So, let's learn more.
Because of our large consumption of refined grains and grain products instead of their whole counterparts, marginal deficiencies of B vitamins are quite common in many segments of the population. Most of the symptoms are very aspecific.
In general, the first thing we need to know about vitamin B deficiency is that there are the 4 Ds: dermatitis, diarrhea, dementia, depression. Now, dementia means some type of funny thinking, so it also accompanies mental disease. Other different signs include hair loss, nausea, fatigue, loss of appetite, the appearance of kidney stones, drowsiness, and mental disease, depression, crazy thinking. Sometimes, actually, psychosis can result. B vitamin deficiencies are associated with learning difficulty, concentration problems, sleep disturbances, feeling tense, nervous, energy regulation, and fatigue. A long time ago, I published a book about the B vitamins and the B vitamins that are water soluble and G vitamins, which are water and alcohol soluble, and put this into a long list to show all of the different B vitamins. You might want to look at that book and see all the different things. It's inside the description below here on YouTube. Then you get an idea of all of the concept of B vitamins and the history and all the different things that go into vitamin B deficiencies and how to correct them.
There are, however, some little signs and symptoms that should make us suspect marginal deficiencies of one or more B vitamins. Let's start with our tongue. B vitamin deficiencies often affect the tongue color. From pink, it becomes bright red.
Here's a list of different tongue disorders and also exactly which type of vitamins are involved with them. So you start to understand that tongue diagnosis is a very powerful part of Oriental diagnosis and should be used in your practice. You can find out an awful lot of things by looking at the tongue.
Taste buds, normally small and uniformly distributed, become enlarged at first, and then they shrink until they are not visible anymore. The edge of the tongue is not smooth, but it shows marks and indentations left by the teeth.
An ulcerated tongue can tell us about acid-alkaline imbalances, vitamin K deficiency, iron excess. We can get indications of manganese deficiency, tardive dyskinesia.
The tongue surface is not smooth either, but has fissures. At first a big vertical fissure right in the middle, then all over its surface.
These fissures can tell us about B6, B12, B3 deficiency, and we start to get an understanding that the tongue is so incredibly involved with B vitamin deficiency.
If B vitamin deficiency persists, these fissures eventually disappear and the tongue becomes completely smooth. Not the silky smoothness of a healthy tongue, but a totally flat and shiny surface, oftentimes also swollen and sore.
If there's a white coating on the tongue, it can tell us about fungus, B6 deficiency, zinc deficiency. The red color, beefy red color, B5, pantothenic acid, B12 deficiency.
The landmark signs of B vitamin deficiency, and particularly B2, is angular cheilitis, painful cracks at the corner of the mouth that reopen every time we open our mouth wide. Before it comes to that, small vertical fissures of the lower lips are also a sign of B vitamin deficiency.
Yes, cracks at the corners of the mouth are definitely an indication of B vitamins, zinc, iron, niacin, riboflavin, B12, classic being able to see this and the little tiny signs that start to develop. And this is a classic sign that B vitamins are either not in the diet or are not being absorbed.
The lower lip becomes dry and flaky. The upper lips instead becomes smaller. In many older adults, as a result of years of marginal vitamin B deficiency, the upper lip has almost completely disappeared.
Herpes and cankers are aggravated by B vitamin deficiency. So sometimes there's an interplay, an interaction, an aggravation of a vitamin deficiency with a viral
Vitamin B deficient individuals are very sensitive to intense daylight. Out in the bright light, they are more comfortable wearing sunglasses. In contrast, they have a hard time seeing in dim light. They are often the first to turn on the light as the sun sets.
Puffy eyes, bleeding gums, vitamin C, pale skin, B12, iron deficiency, pale lips, dry hair, biotin, B7. We start to understand vitamin deficiency.
I realized my mom was B deficient when in the afternoon she would keep asking me why I was reading in the dark, when actually I could still perfectly read without any effort. B deficient individuals often rub their eyes and sometimes feel as if they had sand or dust grains under their eyelids.
And B12 deficiency will affect the eyes, as well as tobacco, alcohol, and other nutritional problems. Now, the problem might not be just in the vitamin, but absorption of the vitamin.
With a prolonged deficiency, in the white part of the eyeball, little capillaries start to form, easily detectable because of their red color, and often mistaken for high blood pressure.
Here's an example of some of the red little things that develop inside the eye that help to give us an idea that there is B vitamin deficiency.
With more severe deficiencies, the same capillaries form in other areas of the face and body, under the eyes, around the ears, on the cheeks, the edge of the nose, or in severe cases such as the case of long-time alcoholics, all over the body.
And as the B vitamin deficiency accelerates, this redness can extend all around. Alcohol can help to do this, especially on the nose, and this is because it has effects on the vascularity of the skin. We see a host of different vitamin deficiency syndromes throughout the entire body.
Losing a lot of hair is another typical sign of vitamin B deficiency. Losing some when washing or brushing our hair is normal, but if we wake up in the morning and our pillow is covered with hair, then something is wrong, and it may very well be a vitamin B deficiency.
And here's an example of a hair loss from B vitamin deficiency and how it accelerates. B vitamins are needed for so many things in the body, brain, etc., and for hair development.
Muscle soreness, shortness of breath, palpitations, tingling or pins and needles sensation, or occasional difficulties in movement and coordination, as if our muscles were temporarily paralyzed, can be a very serious alarm bell for vitamin B12 deficiency.
Now, B12 is a crucial deficiency, since with so many people being vegan, etc. Mental problems, fatigue, hair disorders, blood, infertility, pain, so many things associated with B12 problems. A host of them, hallucinations, urinary incontinence, and this can be a problem with absorption or diet.
The general rule, with food as well as supplements, is to never get just one of the B vitamins, but all of them at once. Remember that they are water-soluble and with very low risk of toxicity, so if we take some of them in excess, we will just flush them out with our urine without any side effect.
B vitamins are so involved with the skin, the brain, our mood. It's very, very important that we learn how to not just get them in our foods, but how to build up absorption to absorb the nutrients.
First and foremost, eating whole grains and whole grain products instead of their refined counterparts. You already know that the B vitamins are abundant in the bran and the germ, both of which are removed with refining processing.
We need natural B vitamins, not synthetics. Very important that we get natural. sunflower seeds, nutritional yeast, avocado, spinach, kombucha.
Besides a high intake of refined carb, increase utilization of some of the B vitamins, so you get less and you also use more at the same time.
We want to get natural B vitamins because it's a pharmacological fact that synthetic anything is an insult to the body. What we know is that the synthetic, patented, petrochemical vitamins do not have the life energy. They don't have the negative entropy. They really have toxicities, and they do not do the complete action that nature does. When we take a look at crystallized vitamin C, synthetic, we see that there's a difference. We want natural B vitamins.
Regularly eating whole wheat bread, whole wheat pasta, and whole flour products, brown rice, whole kernel corn, and other unrefined cereals including barley, oat, and rye ensures a stable and significant intake of the group B vitamins.
In the old days, there were many classic giant diseases that came out. Now today, it's much more subtle, subclinical aspects of B vitamin deficiencies.
Nuts, seeds, and legumes are also good food sources of these vitamins.
But with all seed products, we want to be able to make sure that they're sprouted. This will activate amino acids, fatty acids, and all the vitamins will be much more active if we have washed away the enzyme inhibitors and brought out a quality of life by getting a little bit of a sprouting action. Thereby, we will be able to deal with things better, such as folic acid deficiency.
Some B vitamins, and in particular folate, are abundant in vegetables, and particularly dark green and green leafy vegetables such as spinach, Brussels sprouts, broccoli, asparagus. Ideally, these vegetables should be eaten raw or quickly steamed and not stored for too long, as folate is sensitive to light and heat.
Folic acid and other B vitamins were crucial in our dealing with mental disease, mania, schizophrenia, and the like. As it's very, very important to get this, because so many people do not get it properly with the processed foods. But once we can get the B vitamins into the system correctly, we can stabilize most mental disease. But we also have to worry about the bowel flora to get the different chemicals produced in the body into the bowel. If we can balance the bowel flora and get the B vitamins, we can help deal with these mental diseases.
Group B vitamins are also well represented in foods of animal origin: milk and dairy, eggs, meat, and fish. As you already know, vitamin B12 is a little bit different as it's an animal-only vitamin. It is mostly abundant in animals' liver, but it's present in all foods of animal origin.
B12, if you have healthy intrinsic factor in the stomach, the different bowel bacteria will help you to make your own B12. This is how certain types of vegans can exist. But we need to understand that we need to develop absorption to be able to get the B vitamins. We study absorption very thoroughly in the Fossil Lab book in order to understand how to stimulate absorption of nutrients in the human body.
Our gut bacteria are also capable of building some of the B vitamins in our colon, and some of them can be subsequently absorbed and contribute to cover our needs.
For almost a century, antibiotics have been hurting the body and creating problems in the bowel flora. That sugar and other factors are creating problems, and this interferes with our absorption.
For this reason, it is wise to favor the selection of a healthy gut microbiota by regularly eating prebiotics, such as dietary fiber, and probiotics, such as fresh yogurt.
The probiotics will be killed by most stomach acid, so to get it by the stomach acid, we take a large glass of water with the probiotics on an empty stomach first thing in the morning. Now, all of the drugs, the neuroleptics, antipsychotics for psychosis, for schizophrenics, etc., they all work by blocking dopamine unnaturally. We want to try to help. These create side effects, these antipsychotic formulas, and we wanted to be able to try to help people. I wanted to be able to use B vitamins and to get the B vitamins and GABA to be able to sedate the excess dopamine and to help get these people into health. To clean up their bowel flora, I developed the use of this soup that they would take once or twice in one day, just once a month, to kill the bowel bacteria. Then we replenish the bowel bacteria with the drinking water, as we talked before. Large glass of water with the probiotics, first thing in the morning, empty stomach, boom, get the bacteria where they're going to be. Now we take the vitamins with a little touch of baking soda. This is going to be done after eating. The B vitamins are digested and absorbed better in a slightly alkaline. We can see here how long it takes for different foods, so we want to be able to judge that when the food has left the stomach, when the pyloric valve has opened and the stomach has done its job, then we want to supplement the B vitamins, possibly 2 hours after a meal, etc., with a little touch of the baking soda for alkalizing effects, and now we will get a greater absorption of our B vitamins. Good quality fresh food, and make sure we get the B vitamins. They're susceptible to the heat and temperature, so we want to make sure it's fresh, as raw as possible, stir fry, etc. And now we got our B vitamins into the system. We're absorbing them, we're utilizing them, and mental health can take off all of health. Surprising how powerful these are. As we look at synthetics and their side effects and natural medicine, we start to understand more and more about what we really need. So this is Desiree Dubonnet. I hope you learned a lot about D vitamin deficiency and nutrition.